Okay, so like I said, there are a number of trunk and extremity tissues that blend or merge through bioflow into the connective tissue layers of the thoracolumbar fascia. And so the thoracolumbar fascia can then affect tension and stiffness levels into, for example, the upper extremity through a tissue like the latissimus dorsi. Okay, which remember we said that it connects into the superficial layer of the thoracolumbar fascia. It also has effects into the lower extremity through a tissue like the gluteus maximus, particularly the gluteus maximus on the opposite side of the lats. But remember that there's also effects into the some of the trunk muscles, and I mentioned the field of structures before, but you can also add to the list the external obliques, which recent anatomical studies do show connections with the thoracolumbar fascia as well. So the TLF then acts almost like a relay station for the movement or for the flow of force transmission in various directions within the body. Now, during injury or during trauma, or let's say during overuse of certain components of the thoracolumbar fascia due to maybe a decreased mobility of, let's say, the lumbar spinal segments. This can lead to a buildup of fibrosis. And we've talked about fibrosis in the past, and we know that fibrosis creates tissue deformation, which results in many times deficient feedback mechanisms. And focusing on decreasing that localized aberrant tension within the thoracolumbar fascia and increasing tissue stiffness and resiliency can improve not only tension imbalances and possibly load transmission, but it can also help restore some of the sensory feedback pathways, even actually resulting in a decrease in pain levels. Actually, there's currently lots of histological and anatomical and functional evidence that the thoracolumbar fascia has extensive sensory innervation. And we're not only talking about mechanical and nociceptive, but also autonomic. And actually, with this latter innervation, the autonomic innervation, this might potentially explain why some patients with low back pain, especially chronic low back pain, have increased intensity when they are under psychological stress.